Hello, good evening. My name is Evelyn Nema Mzungu, a student in nutrition specialty in nephrology, and today's topic is kidney transplant. Kidney transplant is one option to treat patients with end-stage renal disease. This is done by placing a healthy kidney into your body where once attached, it can perform all functions that the failing kidney can't. Deciding to undergo the process is the decision between the patient, family, and physicians. Requires a careful thought to make sure it's the right decision for you. Up to what point does one need a kidney transplant? When one has end-stage renal disease as a result of repeated urinary tract infections, kidney failure caused by diabetes or high blood pressure, polycystic kidney disease, or other inherited disorders, glomerulonephritis, which is inflammation of kidney filtering units called nephrons, hemolytic uremic syndrome, lupus, and other diseases of immune system. Other conditions such as congenital defects of the kidney may result in the need of kidney transplant. Selection of a recipient. Appropriate selection is important for successful outcome. Careful evaluation of medical, immunologic, and psychological status is done to identify and minimize potential complications after transplant. Criteria for transplant. Usually, the recipient is younger than 70. Patient has life expectancy of 2 or more years, expected to have improved quality of life, and medical prescriptions of existing complications are done before the transplant. Candidacy is determined by a variety of medical and psychological factors that vary among transplant centers, with diabetes mellitus and cardiovascular diseases considered high risk. In diabetic patients, preemptive transplant, which is getting transplant before you need to start dialysis, is preferred. Some centers reject patients with morbid obesity, those who continue to smoke despite the cessation interventions being done. Contraindications are disseminated malignancies, refractory cardiac disease, chronic respiratory failure, extensive vascular disease, unresolved psychological disorders, and also HIV positive patients in some centers is a contraindication. Donor sources. Compatible blood type disease donors, blood relatives, emotionally related like close or distance living donors, for example, husbands or distant cousins. Charitable living donors, known or unknown to the recipients. Paired organ donation. Appropriate selection is important for a successful outcome. Careful evaluation of medical, immunologic, and psychological status is done to identify and minimize potential complications after the transplant. Evaluation of a donor. For a living donor is required to undergo extensive multidisciplinary evaluation to ensure the donor is of good health, doesn't have diseases that predisposes the renal failure or operative complications, psychologically and financially stable. Cross-matching is done at the same time and again a week before the transplant. For a deceased or cadaver donor, must be healthy individuals who suffered irreversible brain damage, must have effective cardiovascular function, must be supported on a vent to preserve the organs to ensure quality of function, must be free from physical and psychological complications or conditions, permission from the next of kin, even in presence of signed donor cards, is very important. Advantage of a live donor: better patient and graft survival, immediate organ availability, immediate function. Recipient has opportunity to be in best possible medical condition as surgery is elective. Pre-transplant procedure. On the donor side, one has to ensure checking up on human leukocyte agents, urinary tract infections, and also cytomegalovirus serology has to be done. On the recipient side, UECs, urinary segment, albuminuria, fasting blood glucose, oral glucose tolerance test, lipid profile, LFTs, blood group compatibility, cross-match of T and B lymphocytes has to be done. Renovascular angiography also is done. The cost can be about 150,000 to 200,000, by which most Kenyans are unable to raise such money in cash. One disadvantage is that NHIF can be used only during transplant, not during preparation of the transplant, that is during the pre-transplant period. So most of the time it is a hard deal for the poor. The donor and recipient see the nephrologist for complete history, physical, lab, and radiological studies, compatibility tests performed between the donor and the recipient, prescriptions for infections is done before transplant, psychological support to both donor and recipient offered by transplant psychologists. It is very important. Hemodialysis is done a day before transplant. Ensure echogram, lab works, chest x-ray are ordered and done. Ensure the recipient is in optimal condition. Ensure dialysis is done prior to the operation. The patient on peritoneal dialysis must empty peritoneal cavity before going for surgery. Maintain patency of the vascular access. Label the vascular extremity dialysis. Prepare the patient emotionally and physically for the surgery. Review operative procedures and what is expected in immediate post-operative recovery period. Stress on the chance that the kidney may not Am I audible enough?
Yes, you are, Neema, but I think there's a problem with your network.
What's happening on my side? Because on my side I can see that I'm all right. Am I now audible enough?
Yes, you are, Neema. Continue.
Okay. So where were we on your side? Okay, let us continue.